What's the most effective treatment for a double chin? First of all, I want to define what a double chin is. People call a double chin something where this area is full, so it looks like the contours are double. There's a chin, and then there's a neck convexity that makes it look like we have two chins. A double chin is a euphemistic term. We really don't have two chins, but it's the generalized appearance instead of what we all want, which is a very angular jaw neckline. That's what everybody wants. And in fact, if you look at most pictures in ads, they take the photographs and they darken in the neck, which makes the brightness on the chin and jawline look like there's a highlight between bright light and shadow. And that makes us look very angular. And we all know that we like that appearance in somebody that's a model that has a very angular jawline. We don't like skin to hang down. We don't like fat to hang down. We don't like muscle to be redundant and overworking. So the first thing that I do is I ask myself, what is the cause of the unnatural or the less than ideal neck and chin irregularity? Is it, one, the fact that the chin itself is weak? In other words, could they do better with more chin protrusion, more projection of the chin? That's number one. Number two is there redundant fat here? Is there too much fat here? And that's a very common one. Is the muscle lax and there's banding of the muscles? And I had banding of my muscles last week, but somebody treated me with Botox and I'm not banding as much. I often say to my patients, show me your bottom teeth. And when I do that now, by the way, you don't see my bands because I got Botox. They're not as prominent. So that's number three. And number four is the skin sagging. It could be any or all of those things. The simplest and the easiest to treat is excess fat. We make a little incision here, we put the liposuction device in, we take out the fat, and if the person's young and the skin's relatively taut, it will follow the area where we've taken fat out. On the other hand, if the patient's a lot older and the skin is lax, it probably won't follow the fat removal. So in older people, I often tell them, you're not a great candidate for chin liposuction alone. We might need to do lipo and a lift. Some of my patients need augmentation of the chin. That's done through the same incision that I do the lipo. So it's very common for me to do the combination of a little bit of chin augmentation with a small implant and a little bit of liposuction. That gives more projection and more angularity. And that's a beautiful thing. In more rare cases, we've got to do something to their neck, lift up their neck skin, tighten their muscles, sometimes cut their muscles to allow them to redrape. So all of that. So diagnosis is the key. So often I'll get somebody that says, I want liposuction and everything's saggy. They're not a great liposuction alone candidate. So how much does it cost to get rid of a double chin? It depends on what you have. It depends on who's doing it and what they diagnose. And then you've got to get in the same place with them and believe the effectiveness of their prescribed treatment. I like to diagnose each of my patients individually, look at what I see. I don't take anything for granted. I diagnose them carefully and make a decision on what to do, and then I tell my patient and see if they like that idea. Consults are key. Diagnosis is key. Come see me. We'll diagnose you, and if you like, we'll treat you. I can answer any of your questions about your chin, your jawline, your neckline, and anything around that, the fat, the muscle, etc. What's contributing to your jaw neckline that's less than ideal? Thanks a lot.